Did you know that the most common cancer in men is prostate cancer and that there is a quick and easy method for its early detection? One day a year dedicated to your health can make the difference between life and death. I am Associate Professor Vassilev, and today I will tell you the most important things about the so-called prostate marker PSA. What exactly is this test? How is it done? What are the normal values? When should you be worried? I will also give you practical tips on how to prepare for the test so that the results are as accurate as possible. And do not forget to subscribe to our channel so you do not miss useful information about your health. What is PSA? Is an abbreviation for prostate-specific antigen. It is a protein molecule that is produced by the cells of the prostate gland. It is important to emphasize that PSA is not a tumor-specific marker. This means it does not directly show the presence of cancer, but simply reflects the state of the prostate as a whole. Think of it like a warning light in a car. When it comes on, you know you need to pay attention, but you do not know the exact cause. Even in a healthy man, very small and limited amounts of this PSA molecule leak into the bloodstream, and there are certain standard reference ranges that we will discuss later in the video. But when there is already some problem in the prostate, be it cancer, infection, or some other condition, increasing amounts of prostate-specific antigen start entering the blood and its values begin to rise. That is why we say PSA is a marker for the prostate and not directly for prostate cancer. It signals to us that something is happening with this gland and we need to investigate further. Undergoing testing for this tumor marker is simple, painless, quite fast, and relatively inexpensive. In most laboratories, it is between 20 and 30 leva. This is actually a simple blood test that you can have done along with other annual tests like a complete blood count, blood sugar, and so on, to save yourself unnecessary pricking or trips to the lab. The result is measured in nanograms per milliliter of blood. These are truly very small amounts, but modern laboratories measure them with very high accuracy. And now I will give you some useful tips on what not to do and how to prepare in advance for the test to avoid falsely high or low results. To get accurate results from the tumor marker, there are several important rules you must follow. For example, 48 hours before the test, avoid intense physical exercise, especially cycling or exercises that strain the pelvic floor. It's best not to have sex for 24 hours before the test. If you are currently dealing with infections like cystitis or prostatitis, you should wait at least 4 to 6 weeks after finishing your treatment before taking the test. And something very important, if you take prostate medications from the group of so-called 5-alpha reductase inhibitors like finasteride, dutasteride, duodart, phenacon, and so on, be sure to mention this to your urologist, because these prostate medications can artificially lower the PSA value, and thus we might miss a potentially serious problem. And now comes the important question. What are the normal values of the tumor marker? The easiest number to remember is 4, and PSA should accordingly be less than 4. Of course, there are small age variations. For example, for men under 50, values are up to 2.5, for men between 50 and 60, up to 3.5, for men between 60 and 70, up to 4.5, and for men over 70, up to 6. Notice that with age, the normal values of the tumor marker rise. But please beware, these are only approximate limits, and each case is evaluated individually, taking into account your age, specific symptoms, and other relevant factors. Therefore, never interpret your medical results yourself, but always consult with a highly experienced urologist. PSA can rise for various reasons, and not all of them are related to cancer. Let me tell you which are the main ones. First of all, age. Over the years, the prostate naturally increases in size, and accordingly, PSA rises. This is the so-called benign prostatic hyperplasia and is actually the most common cause of elevated PSA in men over 50. Actually, the prostate increases, but this has nothing to do with cancer and is not because of cancer. The second reason is prostatitis or prostate infections, and this can significantly increase the tumor marker, sometimes even to very high values over 20 and more. And the third reason, as we mentioned before, is intense physical exertion and various activities that can temporarily increase your PSA levels in the blood. And finally, yes, it is true that prostate cancer also increases the tumor marker levels, but it's important to understand that this is only one of the possible reasons. So when your PSA is found to be elevated, please don't panic. An experienced urologist will analyze all factors and determine the next steps in the diagnosis. First, they will ask you about symptoms, family history, and what medications you take. After that, he will examine you and check the prostate with an ultrasound. He might also recommend uroflowmetry and, if necessary, perform a prostate palpation, or what is known as a digital rectal exam. I know many men are worried about this exam, but it is completely safe, quick, and believe me, extremely informative. And then if the urologist has any doubts during the exam, he may order additional tests. One of the most modern methods is the so-called multiparametric MRI of the prostate. This is a harmless test that, however, provides very detailed and accurate information on the prostate structure and exactly what is happening inside it. And if the MRI results appear suspicious, then a prostate biopsy might be necessary. The modern and advanced method is the so-called fusion biopsy. I have included a link up here, or you can find it down in the description below, where I will post a video about it. It is crucial to understand that modern medical science has very precise diagnostic methods, and early detection is the key for good treatment results. Therefore, I highly recommend that every man over 50 should have a PSA test and a urologist checkup once every year. If you have a relative with proven prostate cancer in your family, then start as early as 45 years of age. Remember, prostate cancer found in an early stage has over a 95% chance of a full cure. But when found in a late stage, treatment is much harder and the prognosis is significantly worse. The PSA test is your very best friend in the vital fight against prostate cancer. It is easy, accessible, and can detect the problem long before any symptoms have appeared. Do not be afraid of the tests. Do not delay checkups, and always rely on an experienced urologist for the correct interpretation of results. And if you are interested, you can also watch this video about prostate cancer. You will see that it will be useful to you. Thank you for your attention and see you soon in our next video.